I would say I wish I knew other people dealing with what I was dealing with sooner, because as of recent, I have met 3 other women in my life that have endometriosis and 1 woman that has PCOS, and we've kind of become each other's support. So knowing other people that have it makes it easier, but it's about 11% of women have endometriosis, so roughly. So there's not a lot of us. If you can find comfort in family or friends that you feel safe and protected with, that you feel like you can talk about something so personal with, I think that is extremely important, especially if they're people you know won't judge you or make you feel worse about it.
Hello and welcome to another episode of Life Bloom. I am your host, Joanne Oyedoku. And with me today, I have a very special guest, special in the sense that we're both endometriosis warrior and we have both dealt with the pain, the challenges, the struggle. And, it's so special to bring her on because I really want her to share a story with us and tell us a little bit about our journey. So before we dive right into it, I will just let her introduce herself. Welcome.
Thank you for having me. My name is Dahlia Gerard and I am an endometriosis warrior.
Go, 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 Endo Warriors. All right, so let's dive right into the question. Can you please tell our audience a little bit about your journey with endometriosis?
So I first found out when I was 16 years old that I have PCOS.
Okay.
And when I turned 20, we finally realized another one of the problems was that I am suffering with endometriosis, and started treatment immediately after finding out. So I have been going through treatments for both PCOS and endometriosis for a couple of years now.
Wow. So how did you first discover you had endometriosis and PCOS? And can you tell us some of the symptoms that led you into seeking help?
Yes. So when I was younger, when you first start puberty and get your period and stuff, I noticed mine was always very irregular, very heavy, and extremely painful. So always being sick during those times, I finally convinced my parents to take me to the doctor because I felt something was wrong.
Okay.
And we discovered after extensive testing that I had PCOS.
Okay.
So once I started getting treated for PCOS, it didn't really get better.
Oh.
It got a little bit better, but not much.
Okay.
So after a couple more years of trying to figure out what was wrong, we did discover that I have endometriosis as well.
Okay.
And I've started treatment for that, and I've had 3 surgeries since finding out I had it.
All right, we're going to get into the surgery part later on. What are the diagnosis process like? What was the diagnosis process like for you? And how long did it take to get the answers?
PCOS, with the diagnosis, it took about a year to find out what was actually going on. It was a lot of testing, blood work, biopsies, a bunch of stuff like that. And after a while, they finally figured out that it was PCOS, and they put me on hormonal birth control to help with it.
Okay.
And I was using it specifically for the hormones.
Okay.
And then with endometriosis, once again, a lot of labs, a lot of blood work, and the confirmation was a laparoscopic surgery where they went in and actually saw the endometriosis inside of me.
Okay.
There was a lot of ultrasounds and sonograms and stuff that went along with that too.
Same here. Same here. So how does the endometriosis and the PCOS, in your own case, for me, I only had endometriosis, but in your own case, you had both. So how does this affect your day-to-day activities, physically and emotionally?
It's been very difficult. Having menstrual cycles that would last up to 18 days at a time, very heavy, very painful. I was passing out, getting sick. It was very difficult to begin with. It has gotten quite a bit better after finally finding treatments that have been helping.
Okay.
But it takes a huge emotional toll. I was different than all of the girls I went to high school and middle school with. Still am from a lot of the girls I go to college with. And it's hard to relate to the things that they go through when what we experience is so much different than theirs.
Yeah.
It makes you feel a little lonely.
I know.
It does, yeah.
It makes you, that's one of the challenges that comes with endometriosis. It makes you feel lonely, it makes you feel ashamed, it makes you feel as if you've done something wrong, and we get to
weak.
Yeah, it makes you feel weak. Were you anemic at any point? Because I was anemic because of losing of blood,
Yes.
Oh, okay.
I am currently still on and probably will be for the rest of my life, iron supplements and a high iron diet.
Okay.
Because I was so anemic that I was passing out every time I had my menstrual cycle. I was getting really sick. I was taken to the hospital more times than I would like to admit, just from the passing out from anemia.
Yeah.
So yeah, and I've kind of, with a high iron diet and iron supplements and switching up my lifestyle a lot, it's helped.
Yeah, because I was very anemic when I was having to deal with endometriosis, and I remember when I was pregnant with my second daughter, I was so anemic that they had to transfuse the iron supplement into me.
Oh, wow.
So I have to be going into the hospital like on a weekly basis to get, like, I'll go there for like 2 hours. They would have to transfuse the iron whatever into my system, because they said, I have to be able to build that iron before I go for delivery and all that. Also, when I was going through I used to have anxiety. How about you? How did it affect your mental health, your emotional health?
It has been a very difficult process dealing with the anxiety and the stress that it puts on you. I really didn't have many people to talk about what I was going through with. My mom couldn't relate. She didn't understand. So I tried talking to her, but it didn't always help because she had never been through anything like this.
Same here.
Yeah. So I always felt very lonely, and I was always very scared. It also didn't help that my first couple of rounds of testing with doctors made me very anxious about going to the doctor. As someone who sometimes you deal with bad experiences with doctors. I've been told more times than I can count that you can't have PCOS, you're too skinny. You can't have endometriosis, you're too young, and things like that. So I was doubted, and they said it was all in my head for a really long time, until finally I found a doctor that listened and understood the symptoms I was going through and what I was going through. And she recognized the symptoms and everything and kind of pushed me in the right direction to getting the proper treatment. I'm less scared of the doctor now, but at first it was frightening. It was not a good experience.
Well, and to be honest with you, I had the same experience when I was young, and my mom didn't have it, so she couldn't relate with what I was going through, but she was taking me to the hospital to see the doctors. And every time we go to see the doctor, they will dismiss it. They will dismiss, and they will say, oh, it's just all in your head, you just have a low tolerance for pain, blah blah blah, and all that good stuff. But it never helped me.
It doesn't help.
It just made me think about, is something wrong with me?
It makes you feel crazy.
Yeah.
And the craziest part about that is saying that we have a low tolerance to pain is I've actually noticed that people with PCOS and endometriosis have a lot higher of a tolerance to pain because of how much pain you're in all the time.
Yes.
So that definitely plays a big part in that. Being told that on a regular basis was frustrating, made me very angry, I will be honest.
I know. It did make me angry too. So apart from the emotional toll and all this other thing, are there some specific challenges, especially being in your 20s? Are there some specific challenges that you think that you faced because of these conditions?
Yes. It was very hard for me to talk to anyone about it, so there was that, but learning, because I started having the symptoms of PCOS pretty much immediately when my menstrual cycle started, and everyone would tell me, it's normal in the beginning for it to be abnormal, for it to not have like a regular schedule, but after 4 years of it being abnormal and it not going the way it's supposed to, it was challenging to, especially because a lot of people can kind of figure out when theirs is coming. When you're dealing with issues like this, it happens almost out of nowhere. It doesn't follow a proper schedule. So there was that. There was also my sisters definitely bullied me for my issues. They always have. But they thought I was, once again, they'd be calling me crazy. It's in my head. I'm looking for attention. I was not. I was looking for help, not attention. And so there was that. It kind of separated me from my sisters a lot too, because they went a completely different way with their periods and their, puberty and all of that. It went very differently for them. So I couldn't relate to them in any sense, and they refused to listen to me. But it did help my relationship with my brothers. They became a lot more protective over me, which was nice. They're my best friends.
And I don't blame your sisters. They couldn't relate. They couldn't relate with because they didn't have it, they didn't experience it. So they're like, okay, what?
You're crazy.
We're doing
Yeah.
the same thing. We're having the same process going on every month. So why is your one so different? But this is what we have to deal with, and it's not something that we caused. So I have this 2-in-1 kind of question, and it's what treatments or lifestyle changes have you tried, and has it worked for you, and what has worked best for you? So let's start with the treatment part. How did you get this treated?
A lot of trial and error.
Okay.
Hormone therapy has been a complete change in my life. It has helped me out a lot. I've had multiple surgeries, both for PCOS and endometriosis.
Wow.
I had a surgery in July, and I had my right ovary removed.
Oh wow.
From the damage of both. So I've had quite a few surgeries. I'm on a lot of different hormone replacement therapies and different medication that help mitigate the side effects and the issues that I deal with. Yes, and then the iron supplements and all of that. I take a lot of vitamins. Take a lot of vitamins.
Yeah, we need a lot of vitamins because we lose a lot. And with the pain and everything, I had like close to, I think, between 6 and 7 surgeries myself.
Oh wow.
Yeah.
I think from PCOS, I've had about 3 surgeries just to remove cysts. Endometriosis, I've had 2 surgeries. But my most recent one was actually kind of a combination. They were going to remove a cyst off my right ovary, but when they went in, they realized that I had an endometriosis growth that was wrapped around my ovary and had caused irreparable damage to it. Luckily, they got it out before any chance of sepsis or infection started, which I was lucky for that. I thank God every day for that. There's also part of my treatment, they have, I don't know if they did something similar for you, but I know for a couple of people, they've done something similar. They limit my menstrual cycle.
Okay.
Instead of having one every month, I only have it every 3 months.
Okay.
And that helps. I get the pain for that
period.
That period hurts, but I'm not dealing with that pain and the sickness and the emotional distress every single month. So that helps a lot too.
Okay. So I have a follow-up question. So one of the complications for me having endometriosis is infertility. So have you been thinking about that? As your doctor talked to you about, this might cause you infertility, let's just start talking about ways on how to prevent it or what you can do, has there been any discussion in that line?
Yes.
Okay.
We know that I can't carry my own children. We aren't sure if I'm infertile though. We haven't tested it.
Okay.
So we aren't sure if my eggs are viable yet, but just in case, I did freeze all of the eggs from my right ovary.
Okay.
So I have about half of my eggs frozen just in case. Then I have talked about surrogacy because I obviously cannot carry my own child, and I'm also very open to adoption.
Okay.
I do not mind adoption. I just want a
That's
family.
Good. We were very open to adoption too. When we had our first daughter, it took us 11 years to have our second daughter. But in the process, we were already considering adoption. We already even asking my daughter, how do you feel with adoption? And she was just like, as long as I have somebody to play with. So, we were already trying to prep and, just engage, research on it, reach out to people, talk about it. So I'm glad that you're open to it.
My little sister's best friend, she lives with us.
Okay.
She's gone through a lot of difficult things in life. Her parents are no longer with us.
Okay.
And that happened. They passed before I met her.
Okay.
Before my sister met her, so she was living with her aunt and uncle, and didn't really have much of a support system, much of a family. So we've basically adopted her into our family.
Okay.
And she's like a little sister to me already. So experiencing that, and that alone has opened my mind up to adoption a lot more.
Okay.
Because I feel like I have another sister now.
I know.
And she is so fun. She is so much fun.
You are so blessed. So how have you been able to balance and manage having both endometriosis and PCOS? Just having endometriosis on its own, it's a complication. But how have you been able to manage?
It's been a big lifestyle change. A huge lifestyle change. My diet, the way I like exercising, even my sleep has changed. It's a lot of work to treat both at the same time, definitely. So we started out with the hormones and all of that and realized that alone wasn't helping.
Okay.
So that's when the vitamins came in. I had to completely change my diet. I very rarely eat red meat. I very rarely eat it now. I eat mostly a Mediterranean diet, which helps a lot. Fish is really good. All of that is really good for giving you the nutrients and proteins and all the stuff that you need that you're lacking in. And I eat a lot of vegetables. I've mostly cut out starches and stuff. Well, mostly I do sometimes partake in some potatoes, and I love rice.
Yeah,
Big,
I do
big
too.
I
do love rice.
I'm much more of a rice person over a noodle person too.
Same with me. Same here. I know that, and I'm glad that you dived into the diet, because I was about to ask you a follow-up question, because I know that as an endometriosis warrior, we're not allowed to eat a lot of inflammatory food.
Yeah, very
and
little
what
butter and oil.
exactly is life without fried chicken, French fries,
It's
and
not
stuff
fun.
like that? It's not fun.
I love food. Food is my love language. That's
Okay.
how I show people that I care about them, is I love to cook for people.
Oh, really?
And I love to feed people.
Wow.
But with my diet, it's
I
a
know.
little hard. So I tend to, when cooking for a lot of people, I tend to cook a meal for them and then a separate meal for me, which is not always fun.
Yeah.
I have very much cut out a lot of fried foods, but I love fried shrimp. I love it. Every once in a while, and we can't really have a lot of oil. We can't have a lot of
Yes.
stuff like that. Not a lot of butter, not a lot of oil. So it is a different way of cooking. I've noticed, at least for me personally, olive oil isn't as inflammatory for me as like vegetable oil or corn oil or canola oil. Even butter, I feel like olive oil helps a little bit better, but I don't use a lot by any means.
Okay.
I've cut out a lot, but like I said, I do have to cook 2 meals.
I know.
Separate.
I know. And
One
that
for me and one for
That
them.
could be very, very stressful. So let's talk about support system. Who and what has been your biggest support system?
Honestly, my dad.
Okay. Wow. Interesting.
My mom, she doesn't have PCOS or endometriosis, so a lot of what I was going through, she could not relate to. But my mom also has a lot of health conditions on her own.
Okay.
So she's dealing with a lot of stress in of itself. She's very supportive, but it was my dad taking me to my doctor's appointments, my dad sitting up with me at night when I was sick and helping me when I wasn't feeling well. So he's been the biggest supporter, and I can basically talk to him about all of it, which is very comforting. And then my brother, my second older brother, he's become my best friend in this journey of healing and treatments and everything. He has become my best friend, and him and my dad are my biggest supporters for sure. And I love them so much for it. It definitely helps a lot. It's weird though that it's not a woman, it's harder to talk to men about what I'm going through than it is to talk to a woman, because maybe she doesn't deal with the same issues, but periods and stuff, they go through the feminine works. And sometimes they feel more comfortable to talk to you about that kind of stuff. So at first, talking to my dad about all that was weird, very odd, but he's become my biggest supporter for sure.
Wow, great. So in my own case, my mom didn't experience it, but she was always there to listen. My dad didn't have an understanding of what we're even talking about.
Oh, my dad definitely didn't understand, but he knew something was wrong.
Yeah. So I have 2 brothers. One was at home, always home. The other one was never home. He was always in school or working in another location. So he didn't have an understanding of what I was even dealing with or whatever.
Oh, yeah.
But the one that was always home sees me in pain, and he would go talk to my mom. Is there a way we can help her? She's in too much pain and all that. And that really brought us close a little bit. And stuff like that. So what role did or has your faith play in all this?
A huge part. I will be honest with you. I grew up in a Muslim household.
Okay.
My mom is Muslim. My dad is not. He's not religious, but he's not religious.
Okay.
He just doesn't put it under a label, if that makes sense. But my mother's Muslim, so I grew up in an environment that you don't talk about this stuff with boys. Period. They don't know about this. This is women's issues. But my faith has grown a lot stronger when working through all of this, because for a while I didn't have a big support system, so I was constantly praying. I have my rosary beads on me all the time. They're in my car right now. My faith has definitely grown a lot stronger, and I feel the stronger my faith is, the better I feel. I feel like I have more of a connection with the higher power, with God, with the world, that it makes me feel less alone. It makes makes me feel like I'm not alone all the time.
Yeah, that it does play a huge role. In my own case, faith is the bedrock of my life. So I
Faith
couldn't,
and family.
yeah, faith and family.
Mhm.
I couldn't do anything without just praying and just trusting God. With all my surgeries, I go in having faith in God that everything would. I had a surgery that took 11 hours.
Oh wow.
Yeah, that was
I'm
how
so
bad.
sorry.
That was how bad it was. But I'm standing here just because God has been so good to me.
Of course.
And before we continue, I just want us to talk to our audience about the importance of support system.
Oh yeah.
If you're dealing with endometriosis or even PCOS, the importance of support system is key.
Yeah.
So I want you to also encourage encourage people out there that support system is key, and they need to in any way they can find a good support system.
It is. I would say I wish I knew other people dealing with what I was dealing with sooner, because as of recent, I have met 3 other women in my life that have endometriosis, and 1 woman that has PCOS, and we've kind of become each other's support. So knowing other people that have it makes it easier, but it's about 11% of women have endometriosis, so roughly. So there's not a lot of us. If you can find comfort in family or friends that you feel safe and protected with, that you feel like you can talk about something so personal with, I think that is extremely important, especially if they're people won't judge you or make you feel worse about it. I also like to say that you know your body better than anyone else.
Yes.
Nobody else knows what you're feeling as well as you do. And if you feel something is wrong, say something is wrong.
Yeah.
Get the help that you need. And once you start to get that help and go through that treatment and find that support system, it does get easier. You know your body better than anyone else. Don't let anybody tell you something's not wrong if you know something is wrong.
Yeah, I totally agree. If something is wrong, if you sense something is wrong, and you need to seek help. You need to seek help as soon as possible.
As soon as you can.
Yeah, as soon as you can. So, one of the biggest challenge with endometriosis, and I don't know if that's the same thing with PCOS, is the lack of awareness. This endometriosis is a beast.
Oh yeah.
There's little awareness about it.
Very little. I found out about endometriosis when I started getting tested to see if I had it. I was 20 years old when I found out that it was as big of a thing, as bad of a thing as it is. It is by no means, there is very little information for you to get just without having to search for it very deeply. It's not something that's taught in school or in health ed or physical education or anything like that. It's not something that we are taught. PCOS, I feel, has quite a bit more awareness to it than endometriosis does, because PCOS can affect you on the outside as well, while endometriosis affects you on the inside. They both affect you on the inside, but PCOS has physical signs as well.
Yeah.
I truly believe it's something that should be taught in sex education and health education, because they teach us about periods. They teach us about menstrual cycles and puberty and all of that. And they teach us sex ed about the practices of safe sex. I feel like just teaching us to be aware of endometriosis to me is so important, because it could point someone in the right direction of knowing what's wrong with them when they have no clue what's happening. If I had known about it earlier and known about the signs and the symptoms and all of that, I feel like I would have found out that I had it much sooner. So that's why I really do think it should be taught. It should be something that is voiced out more, because it is important to know.
It is.
It's extremely important to know.
And I totally agree with you that if you have known sooner, same goes with me. I did not know. I think I started my period at 12 and I got diagnosed at 27. That's 15 years.
That is a big time difference.
Time difference. And maybe if I had known earlier and I got diagnosed earlier, all the time that my mom was taking me to the hospital and I was being dismissed and ignored and undiagnosed, if something had been done, maybe all the surgery that I had to go through, I wouldn't have gone through it.
Oh, of course.
Maybe I would have not experience the infertility and all that stuff. But, and even as we speak right now, every woman that has endometriosis, on the average, are 8 to 10 years behind.
Mm-hmm.
And that's because of all these
The lack of information.
Lack of awareness. People go see their doctors, complain about pain, it's been dismissed, ignored.
See, I was a little bit luckier in the sense of I have my mom and my two sisters. I started my period later than them. I got mine at 13. My little sister started at 12, so pretty much like a month ahead of, or a couple months behind me. My older sister started when she was 11, So I was watching them go through everything, and I started to realize mine were lasting 2 to 3 weeks at a time when theirs was lasting 1 week. And I noticed pretty quickly that wasn't normal. But it was voicing out that it wasn't normal and trying to get someone to help me that was difficult. But I was lucky that eventually my dad did pick up on the signs, and I only really had to deal with the sickness and the very long periods until I was about 17, when they finally fully diagnosed me after multiple blood tests, urine tests, biopsies, everything. I was lucky there, but PCOS and endometriosis are very different.
Yeah.
It's a lot harder to diagnose endometriosis than it is to diagnose PCOS.
Yeah.
Because you can do an ultrasound and see the cysts. You can do a CT scan and you can see it. You cannot see the endometriosis without going inside and seeing it.
Have to.
And for a lot of women, it's almost too late to be able to mitigate the pain and all of that, because you don't realize until you're past a certain stage.
Yeah.
When I had my first surgery, I was stage 3 endometriosis, and I was brought down to stage 1 after the surgery. They also don't really educate you on what the surgery does.
I know.
They really don't. And how hard the recovery is.
Lord have mercy.
Talk
about that.
Yeah, they went straight through my belly button for part of it too. So I could not move my torso at all. Oh, that was awful.
Yeah.
But it's if there are growths in certain places, they can't remove them, not safely. So if you have a growth on your bladder, they can't remove it, because if they puncture the bladder, that is so much more dangerous than you could imagine. If it's on your...
They did on mine.
They did? Oh my goodness, I'm so sorry. They didn't touch the one that was touching my bladder. They were like, we're not going to risk it. I'm so sorry.
Yeah.
How was the healing of that?
Oh my God.
A nightmare?
The healing took forever.
I could imagine.
At a point, I can't even walk. It was crazy. It was really crazy. I had so many complications. My husband had to take me back to the hospital at some point. I got readmitted to the hospital. It was crazy.
Did they do yours laparoscopic with the 4 little incisions and the cameras?
When I got diagnosed, that was the first thing they did.
Yeah.
And so, when I first met the doctor, I've seen several doctors, and they've said, oh, you had fibroid, you had this, you had that. So, and because my husband was also a medical doctor, so he didn't know that I had endometriosis.
Yeah.
But it was just like, no, this is just
something's not right.
Something is just not right here. So, and it was like, no, we're going to keep seeking medical help. So when we finally got to this doctor and we gave, what my symptoms were and the signs and everything, she was like, what you're telling me looks like an endometriosis, but we're gonna have to figure out with a laparoscopy.
Yeah.
So they went in and she was thinking, oh, it was just the early stage of endometriosis and we're gonna have to take care of it with the laparoscopy. My dear, when we got in, when I came back, when I woke up, she told me, she said, it's a mess in there. We can't undo it with a laparoscopy.
Really?
I'm so sorry, we cannot. So it was a really big cut. She had to refer me to another doctor who then had to do the surgery that took the 11 hours.
Wow.
It was a big cut because all my bowel, my bladder, everything has been covered up with endometriosis. My tubes, my ovaries, everything had been covered up.
And they managed to get most of it out?
Yeah.
Okay, that's
They
good.
managed to get most of it out.
All of my surgeries have been laparoscopic.
Oh no.
So that's where a big difference there is. Even with removing my ovary, it was a laparoscopic procedure. They did it through the tiny incision and they pulled it out. All of it's been laparoscopic.
Oh, no. Up until now, I have a very deep cut all the way down. Alrighty, so let's move on. What advice would you give a young lady facing similar diagnosis?
I'm gonna go back to saying that you know your body better than anyone else. If you feel something is wrong, something is most likely wrong. Don't doubt yourself. Don't delay the seek for help, because once you start getting, it's going to be difficult. It is, but it gets better with the proper treatment and with a proper support system. Make sure you have that support system. But don't let anyone tell you you're crazy, or it's in your head, because it's usually not. It's no. Most of the time it's
real.
It's real. The only time I can say it's not is if you're a hypochondriac. And sometimes it still is real if you're a hypochondriac. So, but you know your body better than anyone else. Don't doubt yourself. Don't hesitate. Seek help and seek out a proper support system. The more you do that, the better chances you have of finding out sooner. And as you said, it takes multiple doctors. Sometimes you have to go through trial and error periods, finding a doctor that believes you, finding one that listens. It can be daunting. It can be scary. Yeah. But keep up with it. Yeah. Keep pushing. Don't let anyone tell you you're crazy.
Thank you so much. So now to our last question. And thank you for doing this with me. I truly appreciate it.
Thank you for having me.
Thank you. So the last question, what keeps you, because I just love your spirit. With everything you've been through with the PCOS, with endometriosis, I just love your spirit, and you have not allowed that because to be honest, endometriosis has a way of making your life so gloomy. And that's why a lot of people fall into depression with endometriosis. So what keeps you motivated and hopeful each day?
So I definitely did fall into that pit of depression for a while. Wow. And it took a while to kind of get myself out of there. Honestly, it's gonna sound really crazy. Not only is it my family, it's my pets. I have a cat with chronic health conditions. Okay. And without me, she wouldn't survive. And I also want to make a family someday. And if I have a daughter and I see those symptoms, I'm gonna know immediately, But it's looking towards the future, and I want to be able to help people. My goal is to be able to help people and take care of people in a sense of they are not alone and they will not be alone. That's what pushes me. And my cat. She has a lot of health conditions, and I'm the only person that knows how to take care of them. Wow. I adopted her before I knew she had the conditions, but she's very sweet. And she's like my little baby. Wow. Wow. My friends and family definitely push me a lot, though, which can be a lot of pressure, but it helps.
Thank you so much. Before I let you go, so we're creating this awareness because we feel that this is very, very important for people out there to know. If you don't mind, just speak to our audience about the reason why this is so important for us to create this awareness, for us to spread the word, to share, for people to get to know, because 1 out of every 10 women is dealing with endometriosis. Currently 200 million.
It's also underdiagnosed.
Yes.
It's underdiagnosed and it's not educated. People don't teach you about these issues, which is why I believe that awareness and educating people on this topic is so important, because there could be many women out there that don't realize that what they're going through is endometriosis or PCOS or, any of these problems, because they aren't educated about them. They aren't taught that these are issues, that these are prevalent problems, which is why I believe it's so important, because it is underdiagnosed, it's undertreated, it's not talked about enough.
Thank you so much. And to our audience, I just want to say you're not alone. If you're out there and you're dealing with endometriosis, you are not alone.
Not at all.
Endometriosis is real, it's painful, and it deserves to be talked about. So here are some of the things we want you to do with us. I want you to subscribe to this YouTube channel, because as you have seen today, we're going to be bringing many other people that have dealt with endometriosis. More endometriosis warriors are going to come in on this channel. And if you are out there, you are an endometriosis warrior or currently still dealing with it, and you would like to share your story with us, please DM me. DM me and let us know that you would like to come on and share your story with us, and we will reach out to you. Also, like you have heard us say on this channel, and you have also heard our guest say today, the importance of creating this awareness. We have to create this awareness because as we speak, 200 million people, women, are dealing with endometriosis. That is too much.
Way too much.
Number. We need to get it down, and we need to create this awareness so that people can get early diagnosed, people can be aware of what they're going through, and better advocate for themselves. So please share this link, share the story, help us to spread the word. We really need to get this out there. Join the conversation in the comment section. Share your story, ask question, and
always ask questions.
Yes, always.
There's no such thing as a stupid question.
Thank you.
No such thing as a stupid question.
No such. So, and talking about question, I want to drop this question for us so that we have something to discuss in the comment section. What is one thing you wish more people understood about living with endometriosis? Get into the comment section. Let us discuss about that. And I'll leave you with this. Together, we can break the silence of endometriosis. Together, we can build a community of hope and understanding. Thank you for watching, and we'll see you in the next video.